Hello and welcome to this webinar on safe and responsible use of veterinary medicines. The title should be self-explanatory, should it not? I will emphasize that while safety in the care of vet meds, whether storing them or transporting them, maybe to the near far unit, and especially using them, has always needed emphasis. The word responsible is now very much in the forefront of use because of the real concern of resistance developing worldwide in both bacteria and in parasites, as worms and ectoparasites, to commonly used vet meds. What then do we mean by responsible as well as the safety angle? And I like to think that the slides will explain further, but you will need to perhaps tap into the library to have a view of this webinar in its fullness without just the emphasis points in order to capture the whole theme of responsible use. This slide emphasizes that stock persons need to be able to read the signs or signals from their pigs in order to assess both their health and identify early signs of ill health before even considering any form of treatment. So you need to look and then think about what's happening and then take any necessary action. One further important suggestion of mine is in assessing your pigs, perhaps as highlighted in the visual picture, assess your pigs from pig level, not only from afar or looking down at them. You need to get down and dirty with your pigs. This slide lists just the subtitles that I'll refer to as we go through the webinar. And the first bullet point, that's the highlighted in red, responsible use, is the overarching crucial one. And you might care to just quickly glance at the others at this stage of the presentation, and reference will be made to those. So when should we use vet meds? There will always be a need for pigs to receive vet med treatment in order to ensure their welfare and to properly treat identified pig conditions. However, the mantra is to use vet meds as much as necessary, but as little as possible. That's an overarching title, if you like. And this next slide provides certain of the circumstances for necessary use. What informs you, for instance, that a pig or pigs do need vet meds. Generally, if a pig is noticeably unwell, some form of treatment is likely to be needed. Now, there are other circumstances that we will go through as well. If you've made contact with your vet, then he or she may have been able to suggest a particular vet med or advice that the vet med should be used, or perhaps in really rather complex ones, then the vet might wish to justify an examination by the vet. And these days with telemedicine and available IT transmission of pictures, then that can be also helpful. More and more pig farmers have an updated pig health plan which specifies what to use in situations that arise on your farm, and this ensures that the correct selection of any vet meds, not just the arbitrary, well, I can use some of that because I think I used it last time. That's not responsible. And that can be without the need to contact the vet because it's written down in your pig health plan and there are support for developing a pig health plan through Farming Connect. Quickly with this slide, how should we responsibly use vet meds? ? Adhere to any current pig health plan. We covered that or mentioned it. I haven't mentioned reading and following the rumour antibiotic guidelines, and these are most useful. So I just want to emphasize that now and draw your attention to those. They're available. And the other one that's worthy of this emphasis at this stage is don't use antibiotics just in case there's an infection. Remembering that a lot of pig disease is now a virus anyway, induced, and antibiotics don't work against virus. Returning to pig management and husbandry that reduces dependence on antibiotics. Some pig farmers, a lot of pig farmers tell me, well, this is common sense. Of course I know what feed I'm giving to my pigs, but do we actually match it to the type of pig? And how often do we weigh and feed pigs? Do we do that regularly enough? Do we do that regularly enough to calculate the feed efficiency, which is so often the first influence with a low-level disease? And checking feed troughs and hygiene hoppers is absolutely crucial, because if you don't do that, then mycotoxins will grow, mold in the bottom of troughs like those ad-lib feeders, particularly you see in the picture, will accumulate and pigs will be put off food. Not always that easy to clean them out in the presence of pigs, but it's got to be a daily task. And finally, water. If there's one thing that is often limited on pig units, it's availability of water through nipples or bowls. Are they cleaned? Is there adequate flow? Because pigs like to drink all together, and if pigs don't get access to drink, they will immediately be put off their food. They won't actually eat. Moving to improvements of accommodation as part of the overall improvement in management and husbandry. A weak spot in pigs are their lungs. Huge numbers of pig diseases focus on the lung. It's their weak spot. An increasing ventilation, having masses of air going over pigs if they're housed, lying in clean, dry bedding. The stocking rate is hugely important. Building in a hygiene program for your buildings, making sure the drainage is right so bedding is dry. Pigs will choose the best environment. Outdoors in the upper picture there, you should have absolutely no problem in maintaining good ventilation, bedding in the huts, work out the stocking rate based on the welfare code, etc. This slide just rehearses how the heck do we retain effectiveness of our limited number of antibiotics that are now useful. Checking down the stab points. Sample testing via pigs to find the effective treatments, fecal samples or tissue samples that can actually provide you with the answer as to which antibiotic to use. Use of antibiotics now is severely restricted in feed and getting more so. Suitable vaccines, this is the future. Lots of now available vaccines, very effective in pigs for most of the pig diseases. information. Zoonoses, those are the diseases that pass between pigs and humans, and vice versa. And there are some examples there, and there's a website there if you need to know. So the more we control infections in our pigs, the less risk we have for ourselves and our workers. Just an opportunity to emphasize the safety. We're mainly talking about responsibility, but safe handling and administration is crucial for your pigs, for yourself and stock persons, for the environment, especially water courses and soil if you dispose of the empty containers inappropriately. And there's a very good pamphlet from Health and Safety Executive A31, easily read and available. Item for note, the Code of Practice on the Responsible Use of Animal Medicines on the Farm by DEFRA, and very much supported by RUMA, Pig Veterinary Society, British Veterinary Association, AMTRA, the Co-op, and the Animal Health Distributors Association. So people that are interested in assurance schemes of any sort, and anyway, the Code of Practice from DEFRA is a must in terms of having it in your library, shall we say. Signs of health. Clearly, as I've mentioned in the very first slide or two, we need to be able to identify deviations from what is normal. How do we read the pig signs? And the signs of health on the left and the signs of ill health on the right are ones that you must know about in order to actually realize that the pigs are normal or otherwise, and take time to observe your pigs, perhaps not at feeding time. Best time is when they're not being disturbed. Spy on your pigs. So I'll leave you to go through those sort of things very quickly before we move on. When we need to realize that there are some specific things in the pig checking that you haven't seen before, and you've looked and you've thought about, and then what actions do you actually take? Well, what are the options? And the bottom stabs there. I know what to do. I don't know what to do. I do not know what has caused this, and I do not know what has caused this. I'll give an injection and see what happens. Which is your action? Certainly not the last one. This is thinking about looking, thinking and acting. The picture at the top right is that, are those feet normal or abnormal? And bear in mind that if you purchase from market or a sale, then you are really increase the risk of bringing in latent carriers or hidden carriers of disease, and you may well regret that decision. So a really careful consideration of all those things. This ill health title might interest you. Clearly there are some pictures that are demonstrably not right. 2 questions to mull over. What action would you take if faced with a pig like the lower left? Perhaps even more testing, is the pig lower right normal or abnormal? Actions speak louder than words. What action would you be taking? And this is a rehearsal only. Just have a quick glance of those. That's for the rehearsing when you next visit this webinar. The do's and don'ts of safe and responsible storage of vet meds. All vaccines must be stored between 2 and 8 degrees Celsius. How do you know that your fridge is doing that? Of course, out of the reach of that child. At the bottom left hand is a poor fridge, and you might like to say why. And how do you actually log the temperature in your fridge to make sure it's working properly. Vaccines will not work if they're stored incorrectly. No need for commentary here, just the stab points to check on. The legal requirement for record keeping medicines from food producing animals has to be in that format. Purchase records particularly at the time of administration, and other forms of record also. Where to obtain your vet meds depends on the category below. And do you know these categories where you can get your vet meds from? Do you know that? That's from vet only. That is from your merchant. So how do you know that a medicine can be obtained from one or the other? Look down here for the actual symbol that says POMVPS if you're buying it from a merchant, and that you will have to make use of their registered animal health advisors, not just the person at the counter. I'll make passing mention of the importance of transporting medicines, particularly vaccines, appropriately. Picture below suggests that vaccines are being transported for goodness knows how far in the gloved compartment or storage area of the Land Rover. Correct or not? Key slide that culminates all the things that you've done correctly previously, the actual administration. And here we want to be looking at a question. Am I giving the correct veterinary medicine to the correct pig or pigs at the correct time and by the correct administration method using the correct dose? Again, most are done using intramuscular injections.